essentially, this is the experience of Dr. Williams, who's a PCP. He's providing primary care, so he's just got into his clinic, and he's seeing that there are 3 patients. 2 of them just arrived, 1 of them checked in, and I can quickly ask, when do I have openings for today? And what you see here is, as I look through my schedule, I can quickly ask the questions about my schedule and try to understand who are the patients I'm going to look at today. Right? Do I have new patients on the schedule for this week? And yes, I think it says like we have Samirad who just arrived, as well as a couple of others who are new patients. So that means I need to plan to sort of dig in a little bit more into their records before I see them. Now, with that, let me start looking at the first patient who checked in, Sam Parker. She's come in. She may have a possible UTI, last seen Feb 6th. And she's also on medications for anxiety and migraines. And then just below that, so this part is something that has been auto-generated for the clinician. It's a brief, I'm rushing into the room, what do I need to know about this patient summary. And just below that, I have an intake note from the nurse. She wants the flu shot, but is iffy about the COVID vaccination. You may need to consult. And then let's get into the patient chart for Sam Parker. So here, this is the reimagined view of the patient chart, where again the left side is your patient banner bar. You're able to see all the information that you quickly need for patient safety, including different types of identification, the name, the date of birth, the medical record number, and so on. As well as important things like allergies and what are the weight dosing restrictions and things like that. In the center, you actually see a combined view of both her outpatient encounters as well as inpatient encounters. Right? So you are able to see that there are some of these are outpatient encounters, some of these are inpatient encounters. And below that, right here, you see an expanded view of that summary, right? So you are able to bring in what are the relevant history pieces, there are no new problems, no new medications per se, but these are the potential things that you're looking at. Last encounter, you've seen, and then recent results, right? Like there was a urine culture analysis that happened, and that was positive. And as I scroll down, I see the views change. I can look at the problems, the medications, the results, including the messages in line, right? And let me just take a quick look at the results. And I see, she's had multiple UTI infections. So let me quickly check. What antibiotics have we treated her UTIs with? Normally what you would do is you would go through the last 6 clinical notes, try to understand and piece together the medications that she's on. And again, this may not be an active medication, so you need to look at all the medications and then try to come to this conclusion.
Srini, if I can chime in, as a clinician practicing for 25 years, what you're seeing here is a paradigm shift. Because today, to really get to this level of interaction with the system and system guiding you, I would have to click probably 30 clicks to find all the information, right, and think through all the things that I need. So it starts with summary, right? It was subtle, but the first time I click on the patient, it's actually giving me a summary that's highly useful for me to make my next decision. As I'm walking to the room, I can literally just consume that summary in 30 seconds, and now I know about the patient, right? When I arrive in that room, right, I'm able to basically keep the whole thing conversational. I don't have to be tied to the computer screen, all the patients in front of me. That's a huge, huge benefit, right? Because now I'm looking at the patient and talking to the patient, and the system's helping me, right? As you go through these kinds of workflow, in the past, to find out, you know,
and you know, one of the things, like as Bharat was saying, the clinical AI agent, which is what you're seeing through all these interactions. It's deployed on a mobile form factor today, and you know, normally 10 physicians, they go through the training, they deploy it, and the idea is, you know, it actually not only brings up what this dosage is based on the weight, etc., but it's also giving you the reference, so in case you want to click on it and see the information from the drug pamphlet or the drug DB directly, right? So you are able to verify that. Now, going back, I see that Sam also has problems regarding anxiety, so let me take a quick look at that. So this is what is traditionally called a problem-oriented medical record, if you will, right? Like, so you are, instead of, you know, having a chronological view of the patient, you are now seeing a more problem-focused view. In this case, anxiety. What's her current treatment? What was her relevant history for that? What were the actions taken? And who are the staff members involved with this? Right? And here again, I can ask for questions like, has she ever had panic attacks or shortness of breath? And something like this, again, is hard to get to, right? Like, you're looking for the absence of something, right? It's not a simple search. You're looking for multiple documents where the doctor has said, okay, patient does not have any panic attacks, and you're trying to reference that and come back with the answer. So this is one example, right? Like one scenario. Let me sort of walk you through a couple of other scenarios to show some of the other things that we just discussed. So the next patient is actually Samir Ayad, and here, Mr. Ayad is an 80-year-old male. He's transferring into this practice, so he has multiple comorbidities. He has hypertension. He's, in addition to everything that you saw before for Sam Parker, you have some evidence-based indicators, right? So here are the things where, what Bharat showed earlier, how those actually flow into the EHR without necessarily having to show a big alert, right? Like, you don't want alert fatigue. You want something that is seamless in the workflow for the clinicians. So you have, the clinical trial recommendations based on, the potential depression, etc., that Mr. Ayad may be, susceptible to, and then you also have the care team and some of the care gaps that you need to address, right? Like at a comprehensive level, whether it is senior wellness, hypertension, and so on. Right? So let me sort of do a few queries on Mr. Ayad's chart as well. When was the last assessment and plan for COPD and hypertension? So, okay, this was documented again Feb 6th. How many COPD exacerbations has he had in the last 4 years? Okay, he's had 5 COPD exacerbations. Let me see. How many of these were associated with pneumonia? There were no documented ones with pneumonia. So notice how I'm not repeating the entire context of the question, I'm asking follow-ups, it's able to take the conversation so far. The mental model that we have for the new DHR is, it's a smart resident at your disposal, right? It's eager to help you, eager to get you the information, and sure, like it's ultimately the clinician's responsibility to make sure everything is correct and sign off, but it will try to go the extra step. Has he had a screening CT for lung cancer, and are his vaccinations up to date? So, looks like, again, I'm able to sort of look up his vaccinations quickly, and I see that the CT for the lung cancer is scheduled for next 2 months. This is another way of, in addition to sort of showing in the banner bar itself the care gaps, this is another way of ensuring that, a provider who is actually trying to do the right thing with a very short time is able to get to it quickly. Let me show a couple more things, and then we'll switch to the patient side as well. So let me show the vitals here. So part of vitals, as we were, visits. So part of vitals is, as we were discussing before, it's not just the current reading, it's the trend, right? Like, so why is it trending, in a certain way? And I may be looking at these vitals and say, if something is off, like it's not really linear, there seems to be some fluctuations here. Let me see. Does he have any history of poor compliance with his medications? And this is again, the absence of information that you're looking for, and how to correlate this information across the chart. And yes, this was actually documented as a concern, so you need to be careful in terms of how you follow up with this particular patient. A little later, you will see how we will address this on the patient side as well. So again, these are some of the core capabilities that you will see. How are we doing on the time? So Catherine Janeway, this is an annual visit, not really coming in for a particular acute problem. I see that, again, I have the summary, I have the various results, and I see a message from Catherine. So let me click into that. And, sorry, small text. Basically what Catherine is saying is, okay, I know we are going to meet tomorrow, but I'm almost out of my amlodipine, and I really don't like the way Lipitor makes me feel. Can we go back to rosuvastatin, next time? So there are a couple of requests that I'm getting from Catherine here. So first thing,
sorry,
go ahead.
General information
And so part of it is you're also quickly seeing the clinical context right next to the message. I can also go into the chart again, and I can click on amlodipine, and now you see a different summary. This is another type of generative summary that we are creating for you, wherein we are making sure you have a summary of her treatment with this class of medications. Statins, or in this case, amlodipine, like what is it, like what's the medication history, you have a timeline view, when was this prescribed, how is this being changed, and so on. I can quickly renew the order, because that's what the patient requested, and as I do that, I can change the parameters, and it gets added to my things to do when I go into the visit with her. Yes, go ahead.
The summary is by AI, right?
Yes.
And if you don't, it's wrong for you, you can change it. You can change the summary by the physician.
Yes, so you can ask for more things, right? Like say based on this is where the personalization layer comes in. Just like the summary, the summary for the medication, there was a summary for the patient as well. And as you get into the chart and ask more questions, the clinical AI agent understands that, okay, for this. And this information is again coming from the Multum drug database here, and I see, okay, these are the ones. So, what is the recommended dose? And I see based on her weight dosing, again, I'm able to see the initial dose, the maintenance dose, and so on. And how would I transition her to atorvastatin? And again, this is information that's actually coming in from the drug database, but I'm again continuing the context. I'm not saying from this to this, I'm just saying, how would I transition? And it's sort of picking it up and giving me the right information.
Excuse me, do you have your own database of the drug?
Yes.
Or you connect to MIMS or others?
So,
For US, we use Multum, and for different countries, based on their requirement, we connect to that database, right? Multum, we own it, so obviously we already connected to the US market. For different countries, we have to license or embed, whatever the national recommendation is. And we can train the system on it. But I think that, the most striking thing, right, is you are not talking to a computer. You are talking just like you would talk to any other person. You didn't say, you use her and you just ask the question, what's the best dose? You didn't even say, what's the best dose for rosuvastatin? The system already understood the conversation you had, right? So it's a very natural conversation, which prior to Gen AI we couldn't have with the computer, right? So that's why there is a significant adoption. The minute we put this in front of a clinician, they immediately start using it because they feel like they're just talking to another actual
he actually needs a renewal for one of the medications.
Which is, remember, we make our software, it's web-based software, but we can see it in the browser, on laptop and desktop, and on mobile devices, which is what we're going to see now. But you can also see it wrapped in a native wrapper on mobile devices on iOS and Android, and we'll show the difference between those in a minute. But because people want to be in the App Store and there's native capabilities we want to be able to take advantage of. Okay. So let's start with Isaac. Isaac gets a text message from our system saying, hey, Isaac, you're out of refills, and in order to get more refills, you need to come in to renew your medication. So he taps on the text that he got, and it has a link in the text. And this is just iMessage on the iPhone. And he taps there, and it takes him to the browser. And in the browser, he can log in. Now, I want to deconstruct this for a second. This is the Oracle Health Patient Portal. However, it is branded and provided by Supremo Health to its patients. So we get a Supremo Health color and texture at the top. There's Supremo Health logo, Supremo Health name, Supremo Health watermark. And yes, we do have fun creating branding kits for fake hospital systems. That's enjoyable. And it is powered by Oracle Health. Okay, we are the ingredient brand, as it were here. Okay, he's gonna ask to send a passcode. He's got the passcode, came in, he types it in, taps on it, he hits verify, and now he is logged into the system. Okay, now much like you saw yesterday, the system is laid out similarly to the system that we give clinicians, namely with Ask Oracle at the top. Ask Oracle is our consistent place, our single magic search box, prompt box for CDA, for AI, for searching, for commanding. It's one box to rule them all, as it were. Apologies, I've been watching the Rings of Power series on Amazon. Okay, so that's up at the top, and in it, what it does, as you notice it is giving suggestions all the time to teach people how to use it. So it knows the patient, it's giving customized hints that users can try to ask Oracle a question. So that's why we call it Ask Oracle. Also, it's a nod to the
So this is also a key part of, how do you keep the user sort of trained and focused on things that it can do versus things that it shouldn't be doing, like advising or dispensing medical advice, right? So it will only sort of provide things that are relevant for the based on the patient record, and it will try to sort of handle that information. So one of the things that we have done is, created a whole messaging experience where you can contact your care team through the mobile browser or through the mobile app, and not only will you get responses from the care team, but also the assistant can seamlessly intercept and provide information before you're getting that care team response. Now, in addition to sort of contacting the care team, trying to schedule appointments and so on, the key part is we are introducing new things like this ability to say, hey, you're worried about weight loss, like here's a journaling capability that we want to introduce for patients, where you can start tracking things like weight, if you have anxiety, start tracking your mood, etc. Right? Like these are key things that like I have a 11-year-old, and surprisingly, whenever I go to the physician for her, she says I'm perfectly fine. She comes home and then she starts sneezing. And the physician always says, why don't you track? Tell us what happened, which day. So this is a version of that, us helping patients do that in a much more seamless manner, and do that. Not only do that, but also track the trends and see how you're doing in terms of your, say, the CGM monitor devices, your smart scale devices, and your journal entries. So I want to sort of switch to another who has come into one of the clinics and now wants to essentially go through the process. So let me just quickly show.
Barry, you're gonna need to fast, no food or drinks for 12 hours before you come in. You may have water. Okay, she scrolls down. What's at the bottom of the page? Just like we saw before. She read all the information, she still has a question. Okay, let's bring us your question. Ask her care team about this visit. She taps. The page reconfigures itself dynamically to be focused on her messaging. She asks, can I have black coffee with no cream or sugar? I think that's going to be wishful thinking on her part. Oracle AI responds. The Supremo version of Oracle AI says, hi, Una, I can help. Unfortunately, it's even sensitive. You can't have coffee that morning. Based on the labs your provider will be doing, only water is allowed within 12 hours of coming in. Would you like to know what else you need to do to prepare for this appointment? And she says, no, I'm good now. Great. So now in this example, the system answered the question, not the way Una wanted, but still it answered it effectively, and Una is able to move on. She got her answer, and the care team can see a record of this communication, but they don't need to engage with it. It's all written in language she can understand.
So, just fast forwarding, so she's had the visit with the doctor, just like you saw the clinician sort of get the note in the previous demo. Now the patient is actually getting a patient-facing note of the same encounter. This is where we are summarizing in sort of patient-facing language, what was the diagnosis, what was the suggested changes, what were the next steps from that, right? And if the patient is interested in sort of understanding her diabetes, it can actually show you a patient-facing condition overview, if you will.
And by the way, here is the last remnant of the communication that she had about this visit. Remember? She said, no, I'm good for now. That was her question about can she have coffee before the visit. It's just sitting right there, the message still attached to the visit, which now is in a state of summary because the visit is in the past. She can scroll down, she can show her mom, see mom, look, here's all the things I need to do, here's the vitals that we're taking, here's the labs and results that we're taking, my medication, she has access to everything. She can scroll back up, and remember, she just got diagnosed with diabetes, and diabetes is underlined. All the conditions are underlined. Anything that has a collection of information in her view of her health, she can click on. So she clicks on diabetes, and sure enough, notice what happened up here at the top. Ask Oracle now has a chip in it saying condition equals diabetes type 2. Because she clicked on that, and so it basically instantiated as a query. And now the system is collecting all the information that it knows about Una and her diabetes and putting it in one page, dynamically arranged. It summarizes it with the AI. It shows who her doctors are that are treating her. There's her primary care physician, her OBGYN, and her endocrinologist. And it also gives her data about what she needs to do, and it gives her visits. It shows all the visits, all the labs and results that she's had, medications, prescriptions, all related to this condition. So you can get a filtered view to that condition right here without having to, again, go through all these little hierarchical menus or, try to piece it together yourself. The system does it for her just with a query. Show me everything related to my diabetes. Here it is. And it's presented, even though it's heterogeneous data, it's presented in a really compelling and easy to read way. Make sure your daughter is doing it. Those are things in the morning, then the afternoon, evening. It is a summary view.
So this is the last thing I wanted to end with. This is a summary view for the patient across the various conditions. This is how you get to compliance, right? Like, how do you sort of combine all the things the patient is supposed to do through the day and have that list of tasks, right? So everything from, your diabetes, your, how you check your blood pressure, your heart condition, etc.
An aggregate of the care plans for all of her different conditions, so that she can have one simple place to know what she needs to do next. Because she is frazzled, and also her mom is really excited about this because she wants to know what she needs to do so she can make sure her daughter is doing it. Those are things in the morning, then the afternoon, evening. Look, the moon rises, the sun sets.
Right. I know I was over time, but hopefully this gives an overview of